I'm Chris Cairns. I'm a consultant anaesthetist here in Forth Valley Hospital. I'm Clinical Director for Anaesthetics and Intensive Care, and I'm also the clinical lead for the IHO Flow project. The Institute for Healthcare Optimisation was set up in Boston about 10 years ago by an anaesthetist and an engineer, really to apply queuing theory to healthcare. So queuing theory used all the time, McDonald's, EasyJet, all these Sainsbury's. If you go to a supermarket and you go to the quick checkout, there's one queue for 7 tills. If you check out an airline, there's one queue for 8 chicken desks. Why? Because that's the most efficient way of doing it. And it's applying that science to healthcare. To me, it's all about getting the right patient in the right place at the right time. There's a huge sense in Forth Valley of wanting to improve things, got a good track record in patient safety, specialist wards people feel very passionate about, but we're having difficulty getting the patients that should be in those wards to those wards because of lack of beds for them. And the perception of the staff is that there's lack of beds because they can't get patients out to allow the next patient in. And I suppose the IHO project is scientifically quantifying that and then modelling what it would look like with a virtual change rather than doing a change, seeing it hasn't worked and trying to figure out why it hasn't worked. I think change is always seen as a threat to some, an opportunity to others, and I think that's just the nature of the game. We've now, as a team, been around nearly all the senior clinical and nursing staff, and I think there's a huge want to make things better. IHO have a very good track record from small 200-bedded hospitals to 17 hospitals in New Jersey, all done at once in big healthcare organisations. And certainly the science is sound no matter what country you're in. And they were chosen because of their track record, because of their want to, I suppose, adapt to the UK way of working and apply their principles to that way of working. We're obviously trying to involve everyone in this project. We've tried to get around most senior groups before any change happens. We're reliant on those senior clinicians to then disseminate the ideas down to their troops. We can't, as a team of 3, we can't go and find everyone, but things like this help. The website helps, and obviously keeping sort of their senior staff informed in the picture. And what we're trying to do is not say this is what we want you to do, but here's a picking list of what Forth Valley could do and what do the clinical staff think would be the best compromise between flow capacity, more staff, less staff, all those things. So it's really not to say, as from tomorrow, we want you to work this way. Say, as from tomorrow, these are all the ways we could work, and this is what it would look like, so which would be the best for everyone. There are 35 data streams to submit to IHO, and we've submitted 2 to 4 of those data streams, so it's very early days. We're going to use the data we collect already, so there's not going to be a whole raft of new paperwork for staff to collect, which is important. When we need to collect extra data staff, we'll put extra staff in place to support ward staff. Then we understand where the challenges are in patient flow, which will probably be around Christmas time. So after Christmas, then look at how to improve things. And I like looking upon it as if we're going to pool all the resources we've got and then scientifically redistribute those resources to where they would be of best effect. And I actually have done that. Nowhere have they been before have people said this is rubbish, we want it back the way it was. So not only should patient care get better, because with flow, right patient, right place, right time, all the safety stuff is more effective. Safety without all the safety initiatives we've got in hospital are more effective with good flow. In all the places to work, staff morale's been better, staff retention has been better, staff recruitment has been better, so it becomes a more relaxed, less stressed, better place to work because we know we're doing the right thing by the patients.